Well, good morning and welcome to South Australia's daily COVID update. My numbers for you straight off the bat are that new infections yesterday in South Australia were 3,246, so an increase on yesterday's reported numbers. We now have 102 people in hospitals in South Australia, 12 in ICU, and unfortunately we do have one of those patients in ICU who is now on a ventilator. So an uptick from where we were yesterday. Very pleasingly though, we've kept the numbers at the Women's and Children's Hospital down at 5. You would have noticed a week ago it had jumped up to about 10. That is back down at around 5. Yesterday we had good testing right across South Australia, 20,856 tests which were processed through the laboratories. And I genuinely want to thank all South Australians for coming forward, especially those people who were symptomatic or close contacts. I think South Australians are now realising that we've got to keep that and preserve that capacity for those people that are in the target for us at this stage of the disease. So the PCR tests still flying through in South Australia. We do note that this morning there has been an announcement from one of the private pathology labs to close 4 of their sites here in South Australia and some interstate. I'll leave it up to the company to explain their issues there. They also provide fantastic other services to aged care and other sectors here in South Australia. Our private pathology labs have done an outstanding job since day one. They've really supplemented what we've done at SA Pathology, but certainly SA Pathology stands ready to make up that volume that we can lose through the private lab, which is closing 4 of its sites today. Yesterday I provided an update with regards to the prison population, and we're up at 90. That is further increased today up to 128. I received a briefing from the Minister this morning and then also confirmed with Professor Nicola Spurrier that despite the increasing numbers, all of those prisoners and the staff working within those prisons are all doing well, and we're not aware of people that have been transferred out to hospital apart from the one very early in the day who was from the Adelaide Women's Prison. I can also give you some further update with regards to the vaccinations yesterday, and I've got to say I'm starting to smile a little bit more. Yesterday was an increase, a very substantial increase in the number of people through the SA Health sites. I'm very grateful, but we are opening up more and more capacity all the time. As nursing staff come forward and come back from work, we are surging those appointments which are available online. So please, if you haven't managed to get an appointment for your vaccination or your booster yet, please keep checking online. I think there's plenty of opportunities that will be opening up, and we'll certainly be keeping you aware of new sites that we will be opening up in the coming weeks to meet the expected increase in demand as young children, 5 to 11, become eligible for their boosters, and as more South Australians become eligible for their boosters from the ATAGI change from the 6-month interval down to 4 months as of today. I've also got some good news with regards to rapid antigen tests coming into the state government. As you'd probably be aware, we've got more than 10 million on order, about 1 million per week scheduled to come into South Australia. These are absolutely crucial for our use right across our most vulnerable settings in South Australia. Today we've already had a shipment of 250,000 in, so that was the first of the new year arrivals. We were a little bit concerned with some of the reports that were coming out from the National Coordination Mechanism regarding the various, if you like, delays in supply chains for rapid antigen tests. We've been able to go back to all of the manufacturers for our tests, confirm those dates, but today was a crucial day because we want to see that those first were coming in. And as I said, going forward, we've got more than 1 million that are coming into South Australia on an ongoing basis, and we are looking to work with some of the smaller jurisdictions to support them for consolidating orders with some of the larger manufacturers for the rapid antigen tests. I can also report to you today that businesses will start to receive the money into their tills to support those sectors that are doing it really tough. We know some businesses have got less money going into their tills, and that's why, as of today, there'll be a transfer of around $10 million to more than 3,400 businesses in South Australia. Those transfers will be made. That will be into their bank account. We know that we've got to support those sectors which are the hardest hit, in particular tourism, hospitality, and of course the fitness sector the good news is that money is already starting to flow. So I'll probably leave it there and answer any specific questions that you might have.
Is it good enough for a private pathology provider to remove 4 of its testing sites without notice? We've spoken to some families this morning who waited hours in line expecting to get their tests and they weren't able to get them at those clinical sites. Is that good enough from that provider?
Look, I'm not going to make a comment on a private company because they've got to, if you like, justify their reasons. But what I can say is that Climpath has done an outstanding job as a private laboratory in South Australia. They continue to do good work right across some critical sectors in South Australia. Now, obviously, they've made a decision to close 4 of their sites in South Australia, I think some interstate as well. Other private laboratories are closing down sites interstate. In fact, I read in this morning's newspaper that I think 27 of 28 private laboratories from one other private lab had closed in New South Wales. Some of these are really struggling to get staff. We do have some really critical constraints in South Australia as well in terms of SA Health site workers or SA Health workers who are COVID positive and also being furloughed. So I think, as I said yesterday's press conference and the day before, we're really dealing with 2 issues. One is the immediate health and coping with the, if you like, the capacity within our hospitals, and the other side of it is making sure that we've got the workforce for these critical areas, and we've got to justify and juggle and balance those 2 objectives and try to get that balance right. And I think we've got it about right in South Australia at the moment. Certainly we have 102 people hospitalised in South Australia at the moment, but that's well within our capacity. We have been flexing up our capacity. We'd already done it ahead of opening the border on the 23rd of November for the Delta strain, and now of course we've been able to revise that capacity surge for Omicron, and we continue to look at it pretty much on a daily basis.
What is going to be the flow-on effect for the SA Health run sites today?
So the private laboratories in South Australia do a proportionally small amount of the overall testing in South Australia. SA Pathology is the workhorse in terms of the numbers, and what we've seen in South Australia over recent days is that we certainly have the highest testing rate per capita in the country, and we've actually got the shortest turnaround time for those. So if there is any pathology service in Australia which is capable of picking up the slack, it is SA Pathology. They've done a great job since day one. We did hit a peak just before Christmas where there were some delays in getting those test results out, and it was tough between Christmas and New Year, but in recent days we've been able to see those turnaround times for the tests through the laboratories really go through in good time. One of the problems that pathology labs have at this time, as I might have spoken about at a press conference recently, in the past where there was a very low infection rate, you could basically process 100 samples at a time, and if there was nothing found in all 100, they would all go through. You can't do that with the current wave because there is a very high positivity rate right across the country. So there's no economy of scale with regards to pathology. There's a diseconomy of scale when you have very large numbers of positives. No, just to correct you there, they haven't blown out. They've actually been coming down for the last 4 days. Well, they're going through the laboratory in around about 18 hours in South Australia. So this is considerably lower than where we were a week ago, which was something like 26 hours. And then there's the time, of course, to take the swab, collate those, send them to the lab. So most people should be getting their results in about 24, 26 hours. Now that... Sorry, can I just finish my sentence, please, Andrea? First day back, welcome back. But no, look, South Australia's pathology is really standing up. You would have seen reported in the paper today that you're waiting 5 days in Victoria for a result. You're not waiting 5 days in South Australia, and this is a function of us massively flexing up our capacity in South Australia, but also concentrating on symptomatic patients and those people who are close contacts. And it was a situation where we had a lot of people who were using it to travel interstate previously. We've knocked that out. We had a whole range of people that were using the very, very expensive but also the very, very accurate PCR tests, which are now no longer permitted. And this is really freeing up those resources. Now, of course, there'll be some additional stress today because of private pathology labs closing, but I'm very, very confident that SA Pathology will be able to continue the great work that they've done in recent days in improving their efficiencies to get those results to people.
Do you have any details on the SA Pathology mistake with transporting the samples to and
I think it was a simple logistical error. There were around 100 samples. They weren't COVID, or they weren't all COVID samples. That was just the normal transfer of samples up to the central lab here in Adelaide. The tracking didn't work. A private provider of that tracking, they've been found now and they've been processed.
You talk about the 250,000 RAT tests that
Yes.
arrive from the state today and a million that can be done on a weekly basis. How exactly are they going to be used? How are they going to be distributed? And will people have to pay for them if they want one?
No, it's the ones that are distributed via SA Health are distributed in accordance with the National Partnership Agreement, which is a 50-50 between the Commonwealth and the state. No state is giving these away free of charge. We went through this yesterday. Some states are replacing their PCR test with a rapid antigen test, and they've got to work out their settings in their states. Here in South Australia, we don't have a shortage of PCR capacity at the moment. It's quite possible down the track we will, and so we're putting those protocols in place. Some people who are close contacts interstate are being told, look, come and pick up your rapid antigen test from this site. We'll put you into our system, and so that is a free rapid antigen test from that perspective. In South Australia, those close contacts are using the PCR, which is also free.
But just so we're clear, you're flagging there could be a prospect in the next couple of weeks potentially, if not further, when PCR testing reaches its limit and you just can't keep up, and so rapid antigen tests will go out. Is that what you're trying to say, Brett?
Well, what I'm saying is that we have to look at all contingencies. Some states have had to put the rapid antigen test in as a replacement for the test for close contacts. We're nowhere near our capacity on that at the moment. We are still strongly encouraging people to book in online for their PCR test rather than sitting in their car. We still have too many people that are going to Victoria Park. I know it's hugely convenient and it's right in the centre of the city, but there are many other sites which have much shorter delays. And again, as of yesterday, I haven't checked this morning, but as of yesterday, to book in for a PCR test was certainly around the 24 hours or less, and it's much more comfortable for somebody to be sitting at home rather than in a queue for a long period of time. So I don't know whether other states have this booking in system. It hasn't been perfect since day one, but I think it is massively improved now, and so strong advice is for people to go online, book in for their PCR test, or at least check up on the SA Health website, because we're updating multiple times per day what the waiting times are. Some of them are extraordinarily short, even without a booking. But as I said, most people are still concentrating on Victoria Park, and it's a great facility, but it's often the one which has the longest delays.
Last night the Commissioner tested positive for COVID, probably one of our most high-profile people to get it, along with the opposition leader. Have you spoken to him today? Was he at the COVID Ready Committee?
Yes.
How is he, and what are your thoughts?
So the Police Commissioner called me late afternoon, early evening last night to advise that he had a positive PCR test. Our thoughts are with him at the moment, but he's a pretty stoic individual, and he turned up for the COVID Ready Committee from home this morning. Look, he's got very mild symptoms. Our thoughts are with him at the moment, but look, quite frankly, he's still working. He's just working from home at the moment.
Where are the 250,000 RAT tests that arrive today? Where are they going and how are they going to be used?
So the tests are put into our stores within SA Health, and they're used for a range of settings, for hospital, for outbreaks where there might be in an aged care setting, supporting some of the sectors which really need support at the moment. They're not available for the general public to do surveillance testing on. There's a massive shortage of these right around the world at the moment, but we do need to have them in place for our response. And at the moment, as I said, very delighted that 250,000 turned up this morning, and that we think we're on track for about 1 million per week, which is what we need, and plus with a bit of a buffer built in there. And we do from time to time have to help out in the private settings, whether they be aged care or disability, when there might be an outbreak, and we've got to make sure that we can rapidly get to people as quickly as possible.
Was there any briefing this morning from SA Health with Professor Spurrier about why we've had quite a large spike today in the number of cases?
So I think that what we're seeing now is a flow-on from New Year's Eve. When I look at the increases around the country today, South Australia actually had the second lowest increase, proportionally. Some states were up around 80% increase in a single day, 60%, 30%, 50%. I think we were up about 25%. And I think this is a response to the fact that we did put some pretty harsh restrictions in place on the 26th of December to make sure that we didn't have a big super spreader event on New Year's Eve. But what we do know is that Omicron is very, very transmissible. At the moment, we are seeing numbers increasing right around the country, right around the world. The good news for us, though, in South Australia is we've had a reduction in the number of kids at the Women's and Children's Hospital, a slight uplift to 102 patients in our hospital, but that's well within our capacity to look after, given the surge that we've had. We do have about 30 to 40% of the people that are currently hospitalised who are not fully vaccinated. And so, again, my strong message is you've got to go and have that vaccination as soon as you possibly can. And when you're eligible for that booster, please book in, because 30 to 40% of those people that are currently in hospital are not fully vaccinated, and yet the proportion of people of South Australia that are not fully vaccinated, 12 and above, is around about 10%. So it's a massive overrepresentation for those people that are not fully vaccinated.
So therefore, following up, with New Year's Eve, Professor Spurrier, yourself and others wanted a very subdued New Year's Eve. Did we have a subdued New Year's Eve?
Yeah, I think it was a very subdued New Year's Eve. It was a very safe New Year's Eve. I hope people had a great night, but the reality is we made a plea that people stay safe, be outdoors where possible, keep that social distancing and reduce the caps down at home and in our hospitality settings. I think that's had a very positive effect when we can see some of the other increases around the country at the moment. But we're going to continue to see our numbers track up. We hope to reach the peak later this month and then start coming down the other side. We don't want to have everybody being infected exactly the same time. This would overwhelm our health systems right across the country. It would be very, very dangerous, and that's why slowing down the spread of Omicron, getting those jabs into the arms and spreading that load for our hospitals out is the right thing to do for our state.
The definition of close contact's now been narrowed down to indoors without a mask for more than 15 minutes. A lot of people in the business community are wondering why they're still at 25%, given somebody sitting at another table wouldn't be classified as a close contact. Yeah,
look, obviously we are still very concerned about Omicron. We are very concerned about the spread of this. We're seeing numbers increase right around the country. We don't want to keep any of our restrictions in one day longer than we need to, and I think we've shown that since day one in South Australia. I'll be the first to have them removed, but we're still vulnerable to Omicron. We are seeing very large numbers increasing in terms of hospitalisation interstate. We don't want Omicron to overwhelm our health system in South Australia. So we are being cautious. We need to be cautious, but we are also providing support for those businesses which are adversely affected. Most of those in the hospitality, tourism and fitness sectors, but there are other businesses that will also be affected, and so we've got a broader or more general support package. The Treasurer told me this morning, sitting at his desk, that he'd already processed, I think, more than 3,400 payments out to small businesses, so they'll be hitting the bank accounts later today. That's about $10 million worth of support, and there'll be plenty more going out over the coming weeks.
Today, they said they came out yesterday, we know we heard them yesterday, the hospitality industry. They say that money's not making a drop in the ocean. They lost a lot of money over what should have been their busiest trade. They came out today and said, we want 50% now. What's your reaction to that? What do you mean 50% now? No, look, we're not taking our health advice from the hospitality sector. We're taking it from the health professionals. That's what's kept our state safe. That's what's actually delivered for the hospitality sector the fewest days of lockdown of any state in Australia. So we've got to keep listening to the experts. That's what we've done in South Australia since day one. We know it's hard on certain sectors, and that's why we're providing this compensation. We're only a couple of months out from the election now. Do you think that responding like that to the hospitality sector, a group of small business owners, could damage you at the election? I'm not focused on the election. I'll tell you what I'm focused on, and that is keeping the people of South Australia safe. I think what we've demonstrated since day one is that we have been able to grow our economy and jobs in South Australia because we have kept South Australia safe. So we've got the fastest growing economy in the country last financial year. We had very, very strong growth again in the September quarter, and I expect that to continue into the future. And we are supporting business in South Australia. $10 million went out today. It's our 7th package of support to businesses in South Australia. I'm not aware of any other state which has put further compensation on the table with the Omicron outbreak.
I stand corrected if there were, but I certainly haven't seen anything reported in the media. So again, we've been on the front foot supporting those people that are adversely affected. But our primary concern has got to be getting through this Omicron outbreak. It is gripping the world at the moment. South Australia's got through every previous wave extraordinarily well. We've got a mighty challenge on our hands, but I know by working together we'll be able to get through this wave too.
To clarify, on the 10 million vaccination tests that are coming in, will any of them be for the general public on sale, or is that?
No.
In regards to the toddler that sadly passed away from COVID, have you had any update on the coroner's report and when to expect it?
No, well, that would be with the coroner. We could make an inquiry for you, but no, we make a referral to the coroner, but ultimately it's up to the coroner to make an investigation.
The family have paid tribute to the young baby today. Do you have, there's a lot of concern amongst parents of young children who can't be vaccinated yet. What's your message to those parents going forward as our case numbers do?
Parents, the best thing parents can do who are concerned is to make sure that they're fully vaccinated. Of weeks. It was only notified to the World Health Organisation on the 24th of November. There's a lot of information coming in. I've got to say everybody's working very collaboratively. There's an AHPPC meeting today. There's another one on Thursday. The health ministers will be meeting tomorrow morning. We'll have National Cabinet tomorrow afternoon. So it's basically all hands on deck, doing everything we can at the moment to learn more about Omicron, in particular the effects on children. But I've got to say, one of the stats that I look at every morning, it's one of the first I ask Professor Spurrier about, is what is the hospitalisation for our younger ones within Women's and Children's Hospital, and I'm very pleased that it hasn't increased. I think we had one in, one out yesterday, and so it's sitting at 5 at the moment.
Just further to that, we know that the Education Minister is working, or his department and SA Health are working together to see what schools look like in a couple of weeks' time. What about childcare centres? We know that lots of childcare centres are closed over the New Year period. Is this same work group looking at advice for childcare centres around the state as well?
So that's probably a different group, but I have contacted Professor Paul Kelly, who's the Chief Medical Officer, and also the Prime Minister, just to say, look, we do need AHPPC advice on how kids go back to school and childcare in South Australia. We would prefer to have a national approach. South Australia probably had our students back at school more days than any other state last year and the year before. In fact, we were the first, after the first wave that hit Australia, we were the first to get our students back. And I think we all appreciate that face-to-face learning is a much better environment for our young ones. But we've also got to balance that with the health risks to the students, but also to the staff. So we're taking all of those things into account. There isn't a consolidated position around Australia. I know that people are out there saying, well, we're not giving parents enough time. No state has a position on this yet, and it's much better to get the advice right for parents rather than rushed.
A lot of people were pretty frustrated this morning. They tried to book a booster, but the SA Health website crashed. Do you have any information about that?
There were a huge number of people that tried to access the system simultaneously, and I heard that for a few minutes today the site went down, and we sincerely apologise for that. But it's been up and running, I think, for 99% of the morning, and we're just really encouraging people to go on and to get that appointment, and also to check in, because quite often other slots become available. We still had some excess capacity at some of our sites yesterday. It's the best thing that you could be doing to start the new year. I know you've all got your New Year's resolutions. Well, one of them should be to make sure that you are as vaccinated as you possibly can be, and that your whole family is as vaccinated as it can be. One of the areas that we are a little bit concerned about are the 12 to 17-year-olds. I've spoken about this at the last 2 press conferences. I'm going to keep going on about it. It is down below 70%, so it's much lower. Now, I know that the 12 to 17-year-olds started much later, so they only had their first shots available from September, so much later than everybody else. But those 12 to 17-year-olds will be going back to school at the end of this month. So I know people probably want to get their exams out of the way before they had their shots, but they're due now for those 12 to 17-year-olds, and we're very keen to see that number increase.
Further to the issues with bookings there, President, are you across why there might be a disparity between one of the landing pages, which shows availability at a site on one day, then when you actually click through to book the actual appointment, that date no longer being available? Are you across why there might be some connectivity issues between the health engine websites at the moment?
Look, there are three, or at least three systems that are trying to get people vaccinated. We've got our own mass vaccination clinics and clinics right across metropolitan and regional South Australia. You then have the pharmacies who are doing a great job, and I've got to say thank you to them, and then also our GPs who have done such a great job since day one in South Australia. So there are three systems. Two of them are controlled by the federal government, so if there have been any issues with regards to toggling between those systems, then we apologise for it. But all I know is I get a lot of people that might ring up my office and say, I can't get an appointment. We go online, we can actually book it for them then and there. There are still appointments available in the system, and importantly, every single day I'm going to be trying to flex up the capacity for vaccination in South Australia and provide as many opportunities as I possibly can to get those jabs into the arms, because I know it's one of the best things that we can do. And I want to go through again why it's important. Yes, it will reduce your chance of getting the disease, it will reduce your chance of transmitting the disease, but most importantly, even if you do contract this disease, you're going to end up with a lot lower level severity of symptoms. That means you're going to not be in hospital. With Delta, we were aiming to have around about 5% of people that contracted it going into hospital. The early signs for Omicron is it's closer to 1%. And in fact, at the moment in South Australia, it's tracking even lower. So that's absolutely fantastic news. And so that's a function of so many people getting vaccinated. So don't listen to people when they say, oh, I know somebody that was vaccinated and they got infected. Yes, but there's a very much lower likelihood of ending up in hospital or on a ventilator because the severity of symptoms is much lower, because we are one of the most vaccinated places in the world.
You talk about flexing up the immunisation capacity. Have you got any further capacity to flex up our testing clinics, or is this as good as we've got with SA Pathology?
No, we've been up at around 26,000 in South Australia. That is probably around our capacity. I think yesterday was around 20,000. The day before was 19. So I think by narrowing down and making sure that people are symptomatic or close contacts, we've been able to narrow it down. We did get thousands of additional places available because we didn't have to do tests for people going into Queensland. I think I might have reported previously we were doing between 1,500 and 2,000 screens for people going to Queensland on a daily basis. Well, that well and truly balances out the fact that the private pathology labs are not online, some of their sites as of today. So SA Pathology is a very well-oiled machine. I know that there have been some frustrations with lines, but I just encourage people to compare and contrast the performance of SA Pathology with other states. South Australia, I think, has amongst the highest, if not the highest, rate of testing per capita in the country, and we have amongst the highest, if not the highest, turnaround time. I think at one stage last week we were just pipped at the post by Tasmania, but the turnaround times in South Australia have been absolutely phenomenal, and I really want to thank, as I said, all those people working in pathology right across our state. Yep.
For all but emergency and non-urgent cases.
So category 1 and urgent category 2.
Correct. So everything but emergency and urgent has been cancelled. So non-urgent elective surgery.
Well, I suppose that's one way of putting it, yes.
Do you have any update on how many have been cancelled or how long?
As I said yesterday, very few, because there's not a lot of non-urgent elective surgery which occurs at this time of the year, and we want to keep the pause on elective surgery as short as possible. When this occurred last time, we had we were the first state to return our elective surgery to full scale. Then we had to put some additional resources in to our own system and to the private system to get back on track to keep our elective surgery waiting times at an appropriate level. Some states there's been massive blowouts. I note that in Western Australia they cancelled their elective surgery several weeks ago. Hospital systems around the country are under pressure. I think we all know the reasons why. There has been a drop-off on people going to GPs because of some of the restrictions there, so people are turning up in emergency departments. So the situation that we have in South Australia is not dissimilar to other places, but I think we're probably in a better position than most to be able to flex up our system in South Australia. But look, to Rory's question, I have no doubt that SA Pathology have got the capacity to get back to that 26,000. But at the moment, I think we're almost in balance between demand and supply. A couple of weeks ago, demand was much higher than supply. And we'll just, to Andrea's question earlier, we'll just sort of work through what the implications are of the private labs going offline.
In regards to tests being lost, we obviously know there was a number of tests from Mount Gambier that were lost and have now been found, they're being rushed through. I'm hearing that there are other sites where some tests are being lost, including Hampstead. Have you had any advice about
No. So we've got a really good quality assurance system in place, and so anything when there's taken at one end and they're not arriving at the other, we can pick it up very quickly and then go straight to the source, whoever the logistics company was that was moving it from one site to the central laboratory, which is of course in the CBD. I know with the situation in Mount Gambier there was an hour or so this morning where we couldn't find those samples, some of them COVID, some of them just other blood pathology samples that needed to go into the central laboratory. Dr Tom Dodd, who's the clinical lead for SA Pathology, took it upon himself to make sure he could rectify that as quickly as possible, and I was contacted, as I said, within about an hour and a half this morning. They'd found those samples, so it was a logistical error. And look, you've got to appreciate, we are processing millions and millions of pathology samples in South Australia each year. Sometimes there are logistical issues. But what I know is we've got an excellent quality assurance system in South Australia, and those errors are picked up very, very quickly and rectified.
Is housing close contacts of potential COVID cases in Port Augusta intense on an appropriate protocol?
Yeah, so I think that basically gets knocked down as of today. So we did have a situation, and I was deliberating whether to go into it with limited time today, but you might recall about 4 or 5 days ago we reported that there was a worker within the Sobering Up Centre at Port Augusta who was positive and possibly was working on that site for some days. We then tested all people who were designated as close contacts with rapid antigen tests. We now know that none of those have come back positive. We wanted to find appropriate accommodation. One option, which I spoke about earlier, was to bring them down into Adelaide. And there were plenty of options which were considered, but the one that we worked through with the local community was to keep them up in their local community where their local supports were. So I think it was an appropriate response. Every response has to be taken on its merit. Sometimes we will relocate those people down. We do have around about 100 people at the moment in our Medi Hotel area. So these are people that often come from regional or remote South Australia, and they don't have the ability to isolate or they're not close enough to higher level medical teams should their situation deteriorate, and also people with complex needs. So one of the things that we did was we kept our Medi hotels in place in South Australia. They're not so much processing international arrivals anymore, but we keep them there for when we need to provide greater level of support for people, but of course not in a hospital setting. So we've got about 102 people in the hospital setting and about another, I think about 90 at the moment who are in our Medi hotels.
The Adelaide International Tennis Tournament.
Yes.
I understand there's been a number of positive cases found there. What's your understanding of the situation, and does that show the risk associated with holding major events at this point of the pandemic?
So my understanding is that all players had to have a test before they arrived, and of course when they did arrive, there are no tennis players who have tested positive, but I understand that 2 of the broader support staff were and they're currently in the Pullman. So all of those larger venues are subject to a COVID management plan, and we just leave that completely up to the health professionals. It's not something that we would have any political overlay on whatsoever.
Just to confirm, Professor Story is around at the moment?
Yes. Yes.
Any reason why she's not here with you today?
Well, as I said, she's at the AHPPC. So look, I've got to say the schedule of meetings for health professionals across the country are completely changed. And so we just don't think it's a useful use of our finite resources to have 4 people standing up every day for an hour. But I have asked Professor Sperry whether she'll be able to do a very exciting announcement with me later in the week. So she has said yes, absolutely. I think Dr. Emily Kirkpatrick will also be accompanying me. Obviously, we're not going to see the Police Commissioner for some time. But yeah, look, you're probably just lumped with me for a little while, Rory, doing that. But I chair the COVID Ready Committee every morning, so got a reasonable overview of all of those particular areas. And I just want to thank everybody who has worked absolutely every day right throughout the Christmas New Year period on that COVID Ready Committee, providing their expert input and advice so that we can get on the front foot, stay on the front foot, keep South Australia safe and get through this current Omicron outbreak. Thank you very much.